Welcome to DDW 2025. I'm very happy to be here today. My name is Dr. Mark Pimentel. I'm here to talk to you about another finding with regards to the three-gas breath test. This is a study that was conducted in approximately 6,000 subjects across the United States. These were physicians who had ordered breath tests in these 6,000 patients. Of these, about 3,500 patients returned their breath tests, and 3,004 had a full breath test that passed quality checks and completed, to a specific extent, their symptom questionnaire. What's interesting in this study is that it shows that there were really no differences between men and women, and there was no difference in PPI use in terms of breath test findings, but on average, patients were more bloated who were doing breath testing, suggesting that patients are getting breath tests at the order or discretion of their physician because of bloating, most predominantly as the primary reason for the test. Less so was more severe diarrhea or severe constipation or severe abdominal pain, although that was also across the spectrum. There were differences in glucose and lactulose breath tests in terms of there were more positive lactulose breath tests to suggest bacterial overgrowth than glucose. This is an expected result from previous studies. However, there were a number of findings also similar to previous studies, such as methane was associated with constipation, especially when methane was over or greater than 10 parts per million, which is consistent with the North American consensus. Interestingly, hydrogen sulfide levels were associated with more severe diarrhea. So the higher the diarrhea severity, the higher the hydrogen sulfide. And hydrogen was interacting with methane. So higher hydrogen implied less methane, but interestingly, higher hydrogen implied higher hydrogen sulfide. So in conclusion, this very large-scale study of nationwide patients across the country getting breath tests using the three-gas breath test, that the breath test instrument and testing system performed in a similar fashion to what's been previously published in the relationship between hydrogen sulfide and diarrhea and methane and constipation. Hydrogen sulfide was associated with diarrhea in a proportional fashion such that more hydrogen sulfide implied greater diarrhea, but also pain and urgency. And this study supports the notion that three-gas breath testing is effective at home and can represent what we see in inpatient or in-person breath testing as demonstrated by the data here today. Thank you for your time and attention.